So, Dr. Patel, just to pick up a little bit from what we're talking about in terms of the lack of trained resources and how the work you're doing with the organizations is also showing how it's imperative to have community intervention and participation. Can you take us through a little bit about what you were just saying in terms of Indian attitudes towards psychotherapies and again maybe the lack of trained resources there?
Sure.
How you're seeing that?
So, earlier I mentioned that the National Mental Health Survey of India reported that only about 10% of Indians with a mental disorder in the last 12 months had sought help or received help. But actually, if I ask the question, what proportion of Indians had received psychological therapies, which are amongst the most effective of all medical interventions for any health condition, psychological and social interventions for mental and substance use disorders, the figure would nearly be 100% have not received any of these interventions, with the small exception of very affluent urban folks who are able to pay for private psychotherapy. The vast overwhelming majority of Indians do not have access to these therapies. Now, very often, many people assume that Indians don't like talking therapies. They prefer pills. I've often heard doctors say, when a patient comes to my clinic, they want a pill, they want an injection. Well, our experience has been exactly the opposite. Our work has largely focused on challenging the myth that Indians don't like talking therapies, and we now have shown time and again that very high proportions of those who are offered psychological therapies engage with them and complete the treatment. And we also challenge the myth that psychological therapies require extremely expensive, highly trained human resources to deliver it. Our work has shown that you can use lay people in the community. We can train them, and with adequate training and supervision, they can effectively deliver scientifically sound psychological therapies, producing very large clinical, economic, and social benefits to those who are affected by a range of different mental health conditions, from autism to drinking problems, depression, psychosis, etc.
Can you give us a few examples of, how, even anecdotally, of the sort of work you've been doing
Sure.
in this?
So, one of the more recent programs of work that I'm really excited about is our demonstration that a 6 to 8 session psychotherapy delivered over 2 to 3 months based on the psychological theory of behavioral activation. That is to say, to get someone to actually engage with rewarding and pleasurable activities is a very effective treatment for severe depression when delivered by lay people in routine primary healthcare settings. I'm also very excited that this particular treatment that we call the Healthy Activity Program is now being tried out in Nepal, in Uganda, in Zambia. It's also being tested in other parts of India, and so could genuinely be an innovation that was developed in India and which has potential value and application in many other parts of the world as well. So I'm really pleased about that. We've done similar work with drinking problems. Producing a very short 2 to 4 session treatment for harmful drinking called the Counseling for Alcohol Problems. And a particular area of work that I'm currently engaged in is to develop digital training interventions and supervision interventions to scale up these psychological therapies. Imagine, for example, that in a few years from now, anyone who wanted to learn these therapies, all they had to do was to go online, access our training program, complete the online supervision, and then be equipped with the skills to deliver this intervention in their community.
And you're seeing this as success cases in the sense of when they go out in terms of the interventions they're able to...
Well, that would be a success story, absolutely. At the moment, the success is that we've designed and this intervention. We've shown it works in what we call a clinical trial. We are now engaged with scaling this up through, for example, digital training and supervision platforms.
Well, that's incredible. I want to ask you a little bit also about, so what our attempt is also to be a sort of safe space for conversations, and I think completely take your point that in a lot of cases, especially, you are talking to people of a certain amount of privilege, especially when you're talking about urban audiences, and you've brought in the need to involve the community. We do see that, and I want to ask you a little bit about the work that It's Okay to Talk is doing, because we do see, I think with younger people, more of an openness to discuss some of the issues that are going on, and more of an openness to discuss how they can make a change. Can you take us through a little bit of any of the insights that have come in?
Yeah, I'm glad you brought up the It's Okay to Talk initiative. That's a website actually, and of course the name of the website really tells you what it's all about. It's about encouraging young people in particular to disclose their own experiences of mental health and mental health problems, and in doing so, the idea is through disclosure, much in the same way that you have celebrity disclosure, but in this case, this is ordinary young people disclosing their mental health experiences, that we will challenge and break down some of the stigma and the shame around mental health and mental health problems. It's part of a larger initiative of engaging with young people. We're also using other methods like theatre, film, other kinds of media interactions. And this in itself is part of a bigger program in which we are developing a psychological program for students in secondary schools in Delhi and Goa that includes a very strong component of self-care as well as an app-based delivery of a psychological therapy for young people who have developed anxiety or mood or behavioral problems.
That's incredible. And just to come back to the need to sort of talk about things and sort of help erase the stigma in that way. You've shared your story on that website, part of your story, talking about your mother being one of the 40 million Indians who experience depression. And I thought it was so interesting. I mean, firstly, thank you for sharing that. I think it was a very powerful account. But again, coming back to the fact that most people don't get treatment, you said that there's no X-ray or blood test to determine depression. Can you take us a little bit of your personal story that you shared and how it resonates with a lot of other people?
Yeah, it's one of the reasons I believe that one of the most important reasons why mental health problems are often missed is because they are hidden, and what is hidden will obviously be harder to find. There is no blood test, there is no objective pathological sign that you have a mental health problem, and certainly not one that is commercially of any value. Therefore, there is no commercial incentive either to doctors or to any ancillary service like a pathology lab to actually screen people for mental health problems. What you need to do is to ask people questions. You need to ask them a set of different questions that explore various mental health experiences and then assemble all that information in order to arrive at an understanding about their mental health. This is too time consuming, it's too vague, there's no money in it. And therefore, to be honest, I'm being blunt here, a lot of medical practice in India is driven solely and purely by commercial value. So if there is money in it, then there will be more of that done. That's why you have so many blood tests and x-rays being done. But because this has no value for mental health, at the moment at least, therefore mental health problems go completely undetected.
If there were 2 or 3 things you wished everyone in India would know about mental illness, what would that be?
Well, first of all, as I've said before, mental health is not simply the absence of mental illness. Secondly, that each and every one of us has a very unique life story that determines our mental health. That life story is a product of our genetic inheritance and of the social environments that we've experienced, particularly in the early years of our life, from very early childhood to young adulthood. The implication of this is that for all of us in society who are concerned with mental health, our primary emphasis for prevention and promotion must be in the early years of life, to ensure that environments for children, whether at home, in schools, or in communities, are nurturing, because this is the most powerful prevention that we can actually ensure a healthy development of the brain and therefore mental health in adulthood. And finally, that the best guardian of your own mental health is yourself. Be equipped with the knowledge and skills on how you can promote and protect your own mental health, but equally remember that there is nothing brave about struggling alone. And if you have got mental health experiences that are very distressing, speak to someone. It could just be a friend, it could be a family member, it could be a counselor, it could be a mental health professional. But don't just lock it up inside yourself.
Thank you so much.